Marketing Coordinator here at GetReal Health, and I will be serving as your host for today's National Client Conference session in conjunction with our parent company, CPSI. I'm here with Robin Wiener, the president and co-founder of GetReal Health, and we are excited to welcome you to our International Roundtable event. And each of you joined today, your audio is muted. We have a packed session with 3 great speakers, but we have 15 minutes dedicated at the conclusion of the presentation for the roundtable discussion. At that time, your audio will be unmuted and you will be able to ask any questions to our speakers and any other attendees. You may also submit questions anytime during the session. You do not need to wait until the presentations are completed. You can do so using the Q&A window at the bottom corner of your screen. And since the question and answer period will be the conclusion of the presentations, please be as clear and comprehensive with your submitted questions. If you have a question for a speaker, please say so when submitting. We will have a record of all questions submitted, so if we don't get to your question, all those unanswered will be answered in the coming days. So with the housekeeping out of the way, I would now like to introduce our speakers. John de Boer is a partner and owner of We Do Trust and will speak on our work in the Netherlands. Matt Beadle is a project manager at University Hospital Southampton NHS Trust Foundation and will speak about our work in the UK. And Ali Jumond is a health IT consultant for our partners MEDRAH and will talk about the Middle East. We will end the roundtable discussion moderated by Robin Wiener. So now I will turn it over to Jan, who will let you know about our work in the Netherlands.
Yeah, so my name is Jan de Boer. So we are one of the partners of GetReal Health in the Netherlands. I'm going to talk a little bit about MyPGO. It's the name of our platform, and the Achterhoek. Achterhoek is Dutch. It's a region in the Netherlands. So one of the questions is what is the purpose of our site? MyPGO is a personal health environment. PGO, that's how we call it in the Netherlands. It's for all the citizens in the Netherlands, and especially for the region, the Achterhoek. And what our government did, so we are in a big transformation when it comes to healthcare in the Netherlands. And so we're transferring a lot of health from hospital to home. And one of the programs that the government set up is basically give data back to our patients. And by doing that, or what we're using is calling a personal health environment. So that means that all the data, what is based in, for instance, by the GP or hospital or the personal or mental health care, etc., will be transferred to one place. It's called the PGO, or the personal health environment. Can be an app or a platform, and I will show you in a little bit how it looks like. It's good to mention is that PGO is privately owned. It's not something from a hospital. It's not something for a government. The PGOs are independent labels in the Netherlands and trusted sites for patients. As you see beneath on this slide, that is called, the program is called MEDRAH. And MEDRAH is the standard in the Netherlands for secure exchange of health data between care and users and providers. So what we did get is the MEDRAH label, and that means that we are the trusted site that's for patients, which all the data is can collect it in that site and can be used. So what is the target populations? As I said again, so we start in the Achterhoek region. That's a rural part of the Netherlands. There are about 400,000 citizens who are living there. And the target population in the end will be the 17.5 million Dutch people who live in a small country. We also have a caregivers platform behind the patient platform. And what we did in the region Achterhoek is also that we been together with the clinicians, etc. So we made the site specific for Parkinson's disease, chronic heart failure, COPD, diabetes. But basically, it's also a generic site for healthcare. The reason that the Achterhoek is the first region who is it's basically a first mover. They are very innovative, that area. It's a rural area with a lot of space to cover. It's a lot of elderly people are living there. And basically what they want to be is to be the healthiest region in the Netherlands. And one of the goals there is by using a PGO or my PGO, the personal health environment, is to get the citizens more in control of the data, but also in control of their health. What are the three things what we actually want to achieve with our sites or my PGO? As again, in 2021, there will be a national campaign led by our government on television and all kind of on billboards, etc., to inform citizens that they can choose and use a personal health environment or PGA. So what we see now is that if you ask a regular person in the Netherlands what is a PGO, then probably no one knows what it really is. But that will change. So the market penetration is very important at this moment, and also scaling up and using that in the region. So we did do a pilot in the beginning of this year together with Cadbury Health. That was very successful, and now we're going live with the new site in December. So what we try to achieve is that Cadbury Health or my PGO will be the platform, the best platform, user-friendly, and also mature. And mature is very important in that sense. So what you see now is that it's a new market with a lot of competitions. So we have more than 30, and some people say 80 different platforms. Sometimes it's an app, and a lot of them are not very mature as a platform, not a lot of functionality. So our government is saying there probably will be 3 winners in a couple of years. We hope to be one of them. And of course, by using my PGO, we should improve healthcare. Of course, the quadruple aim is very important for that region. And basically what I said is that we want to transfer healthcare from, as we call it, waiting room to the living room. Besides the generic health care platform, the Cadbury Health platform, it's also very flexible if you compare that to competitors or solutions in the market. So we did now for Parkinson's disease, chronic healthcare, COPD, and diabetes, but we're also working on for youth 0 to 4 years, of course, COVID and all kind of other diseases. What are the 3 things that we learned from our experience? It is absolutely essential that we are using standards, and the Dutch standards are international standards. We'll use FHIR and these kind of things. But the certification process is a challenge, also for us and also for Cadbury Health, but also for a government. For instance, testing service, what we have to test, whether it's secure or not. Our government is also struggling with setting those things up. So we have to deal with that. The other thing is that we are moving in a market with EMR suppliers who have different business cases. That means that there's also there's commercial stakes in place. So the portal market will be a PGO market. So we are fighting also a little bit against the epics of this world to actually give that data actually to the PGO. So that's going to be a law in the Netherlands in doing that, but we are a little bit in, the law was announced, but it's not law at this moment. So that is all the EMR suppliers and the GP suppliers are cooperating, but all in a different pace. So that is a bit challenging in the market at this moment. Now, for the actual success, is also what we learned is key that there will be an acceptance and involvement of patients and caregivers. I mean, that's very obvious, but again, it's very important to emphasize that. And good use cases along with agreed care paths. That's what we did together with the clinicians, for instance, for Parkinson, for COPD, etc. The other thing, the question was asked by Cadbury Health is what we wish we knew before we get started. Now, of course, we did know that it would be a challenge because there are very much a lot of stakeholders in place. So in the Netherlands, we are a country that we don't have a government who's saying you have to do this and you have to comply that. So we are a country of compromises. So that means that you have to compromise between patient, caregiver, my PGO team, Cadbury Health, hosting that with our national telecom firm who's hosting the platform, our government, payers, etc. So in our healthcare system and also basically in our democratic system, you have to get along with each other, and it's giving and taking. Of course, there will be a law, but again, we are a country of compromises. So that means that we have to put a lot of effort in bringing all those stakeholders together. No one is against this, that the patients will get data or more involvement of patient engagement. It's more that, I sometimes call it as world peace. No one is against it, but it's sometimes difficult to reach it if you are fighting with each other in some places. So that is, so we have a generic goal, which everyone very supports in the Netherlands, also patient organizations, etc. But actually to make really things going and doing, that is the issue at this moment. But we are improving as a country at very fast at this moment. And also more a technical challenge is we have a lot of Cadbury Health widgets, and we have the MEDRAH standards that you have to comply to that, and they're not matching in all the ways. So there have to be work from our side, but also from Cadbury Health, and also from a government, to set all those widgets or building stones, as we call them, so that blood pressure have the same definitions as in the different systems throughout our healthcare system for a GP, for a hospital, etc. That's stuff, but we also getting there. So there's another national program is to subsidize hospitals, home care organizations, etc. to that we speak the same language, and of course we have the international standards, but actually to get them really into place, that systems actually working it's a lot of work. And how do we engage our patients or your patients was the questions. So one of the key things also in the Achterhoek is that we involve clinicians, but also a lot of patients. That means that we have COPD patients. There is a patient of 75, 80 years old. He is actually working, or a group of patients actually working in the design to look at functionality. And even some of them are also getting involved in the politics. So we had certain patients in our group who were sending letters to our parliament and government and say why don't things go faster, or we have a challenge with for instance in EMR systems who giving data to the PGO systems, etc. So the users are very much involved, and at this moment they're also very involved in testing the environment that we now have, also the user interface and the functionality. Okay, this last question, so that will be at the end. Basically we have, as you can see, a very beautiful country with nice people who are living there, and yeah, I think it's and everyone is agreeing on that. Having a platform where all your data gets stored, where you can put devices on, and will absolutely improve healthcare, and also our goal, what we have in the Netherlands, to move a lot of healthcare towards home, and also to keep patients more involved, but also to keep healthcare affordable for the Netherlands, because yeah, as in every country, we also have a challenge in that. So that was my end of my presentation. I hand it over.
Yeah, thank you so much, Jan. And now we are going to transition to Matt in the UK.
Hi, so share my screen. So hopefully you can see my screen now.
You're good, Matt.
Cool. So yeah, hi, my name's Matt. I'm the product delivery manager for My Medical Record. I've been working with My Medical Record team here in Southampton for nearly 3 years, and at the hospital for nearly 12 years. So first of all, kind of a slide about kind of the hospital and who we are. Southampton University Hospital is one of the largest acute hospitals in the UK. We have over 1,000. So we have over 1,000 beds and carry out 650,000 outpatient appointments a year. We provide services to some 1.9 million people living in Southampton and South Hampshire. Plus, we provide specialist services such as neurosciences, cardiac services, and children's intensive care to more than 3.7 million people living in central southern England and the Channel Islands. We're also a major centre for teaching and research in association with the University of Southampton and partners including the Medical Research Council and the Wellcome Trust. Our implementation of instant PHR is called My Medical Record. We use this to support the management of a wide variety of conditions. We now have over 40 live clinical specialties using the platform, with everything from cancer services to cardiac, neuro, and specialist paediatric services supporting their patients on the site. We also supply the service to 14 other hospitals across the UK, mainly for the management of patients in follow-up following cancer treatment, and we have another 3 hospitals going on live with this in the very near future. We effectively deliver 2 levels of service. We have a standard service to all patients, whereby we send them a standard set of data, so appointments, documents, lab results, in conjunction with some universal tools that patients can use to support self-management. And whilst this is seemingly quite basic, our patients report this as being extremely beneficial to them. The second level of service is where condition-specific pathways are designed to support increased efficiency of patient management through engagement. This could be from completing a simple form before or after a hospital visit, but it's in its best implementation, it's actually removal of unnecessary appointments. We started work on our site back in 2012. Soon after this, we launched our pilot site, which was designed initially to support patients with inflammatory bowel disease, or IBD, and gestational diabetes. The IBD team continue to use the platform today, and they now have over 2,500 of their patients registered to use My Medical Record. And they've actually done quite a big push this year in particular, with the current situation with COVID, in a real aim to get all of their patients online on the platform, because they can really see the benefit of using a platform like this to be able to kind of help patients with co-managing their healthcare. Very recently, the IBD team have also started to use the platform to support their patients on a clinical study, which really shows the versatility of the platform. So last year, last year they did kind of a pilot study using the platform with 25 patients, and they're now rolling this out kind of in a full nutrition study for over 1,000 patients. I think they're partnering up that with some fairly big kind of national or worldwide organisations. So I kind of mentioned that we started this back in 2012, but it was kind of in 2014 where we started working with our first cancer teams, and that's kind of where things really started to progress. And we initially worked with our prostate cancer team. At the time, due to a significant national campaign, the awareness of the condition in the UK improved significantly, which led to a rise in referral numbers. So this, combined with a national shortage of urology specialist nurses at the time, kind of led to a perfect storm of kind of increased patients, not enough staff. And it meant that prostate services often found themselves under kind of significant pressure. So, as part of a project that was funded by the November campaign and Prostate Cancer UK, we worked with clinical teams, so not just in Southampton, but also in Bath, Liverpool, Cornwall, and Dartford, to create a platform that could support patients whilst they're away from the hospital. So with this platform, we gave patients rapid results, so they could access the results, the blood results, and see the results that directly impacted their condition, and also the tools to message their clinical teams. We also used the survey tool within Instant PHR to build a holistic needs assessment online, that patients could complete in their own time, with the results being made available to their clinical teams. And we did some additional work around this to create what we call red flag questions. So if patients answered a question in a particular way, or a combinations of patients questions in a particular way, we flagged this directly with the clinical teams within 24 hours. Anecdotally, we've spoken to patients where they'd filled in their holistic needs assessment following getting their blood result, and then they had a call back from the clinical team the next day, and that's quite a big change to the way the healthcare services are provided in the UK. So it really made patients feel that kind of they were much more connected with their clinical teams. On the clinical side, or the provider side of the platform, our development team created an application that clinical teams could use to then track their patients, allowed the teams to easily see what stage a patient was on in their cancer follow-up protocol, but also monitor those patients to ensure that they were having their follow-up blood results on time. So before kind of there was the digital platform that supported the clinical teams with this, we often found that patients kind of would get their blood test or blood appointment through the post, but then either wouldn't make the appointment, the letter might have got missed in the post, lost in the post, the patient could have moved and not updated their health record. So there was kind of often times where the teams wouldn't be able to easily find out if a patient hadn't had their blood test taken on time. So once we had this application built, our development team then worked with the development team at GetReal to enable our application to be embedded within the GetReal application, creating a seamless integration for the clinician. So when the clinician logs in now, they don't realise they're looking at kind of applications from two different systems. They see it as one seamless application. As a result of this work on the prostate pathway, the clinical teams can now review up to 30 patients an hour remotely or digitally. Traditionally, they would have seen 6 patients an hour in face-to-face appointments. I mentioned about kind of removing unnecessary outpatient appointments. The platform to date has saved around 50,000 unnecessary appointments. So that's been a significant saving in time and money for both the clinical teams and patients. The introduction of the messaging has reduced the number of incoming telephone calls for patients. So kind of whilst you're swapping a telephone call for a message, the benefit for the clinical teams is that they can manage when they respond to those messages. Unlike kind of with the telephone going off in the office all the time, they kind of have the ability to plan that into the workload, and that helps make the team more efficient in the way they manage their time. And also now patients receive their blood results much quicker, which reduces their anxiety, reduces the anxiety they would have previously felt of waiting for the appointment letter to come through to go and see their clinical team, to receive what was normally the all clear message from their blood results. So we used everything we learned on the prostate cancer pathway and spread that out to our other cancer pathways. So our prostate pathway is used in 15 hospitals now, and our colorectal pathway is used in 9 hospitals. Our breast cancer pathway is used in 7 hospitals. And we also use the learning from the cancer pathways to apply that to other clinical specialties. So our IBD pathway now have a clinical tracker, so they can use it to monitor remote pathways. And we've also used that with kind of our neuro pathway, so our Parkinson's, MS, epilepsy, MND pathways, and also we're starting to use that now with cardiac pathways as well, so heart failure and congenital cardiac pathways. So what's the purpose of our site? We want to place the patient at the centre of the service, engage them at every level to better inform them, support them in managing their own care condition, and make them feel like they're really part of the process of decision making around their care. Perhaps the most obvious use of the PHR is the ability to digitally share data with patients that relates to their healthcare. It's perhaps the most simple implementation of the PHR too, but patients are generally extremely grateful to receive consolidated information from hospital that they either don't normally get access to, or they get on paper, which is either lost or needs to be maintained locally by the patient. We feel the most effective use of PHR is the ability to support two-way transactions between patients and the hospital. So kind of as I've mentioned on the previous slide, whilst we might send data to the patient record, we also ask patients to upload information themselves. This could be again from completing surveys, any number of journals. So our neuro pathways and our IBD pathway, they have journals where patients can either record kind of what they're eating, so the new dietitians can monitor their food diaries whilst the patients are at home. Or on the neuro pathways, we have falls diaries, seizure diaries, or any kind of diary or journal that can be created is easily kind of implemented in the platform. And there's also the messaging. So transactional PHR, as opposed to read-only, also supports service transformation initiatives within the hospital, such as saving clinic time, allowing patients to go paperless, and also the removal of unnecessary appointments. So what's our target population? Our target population is everyone. We currently have nearly 70,000 patients signed up. We have plans to scale this to the entirety of our active population, so that's around 500,000 patients by the end of 2022. Our senior clinicians within the hospital believe the basic level of service should be made available to everyone, so that's the ability for us to push documents, a standard set of lab results and appointments into the record. And this will make future service transformation, will help to make future service transformation built around the patient record much easier to implement. So the three main things we're trying to achieve with this, which you might kind of picked up from the previous slides, are putting our patients first. So this means making sure we have a platform that works for patients, and ensuring it's easy to use, intuitive to use, and gives them as much benefit as we possibly can. Demand management, so using the technology to reduce unnecessary appointments, and helping the clinical teams improve efficiency of existing services. So what kind of we're keen to do is, obviously we want to implement the kind of the new platform within clinical teams, but we also want to work with them and look at their existing processes and workflows and see where the technology can be used, rather than just kind of giving them a system and letting them get on with it. And also co-production. So this is important with the patients, to making sure that patients are at the centre of the service, and engaging with them at every stage, but also making sure that the clinical teams are always involved with the developments we're making and the improvements we're making across the platform. So the three main things we've learned from our experience so far are get senior clinical leaders to lead the change. Seemingly limitless possibilities can result in a lot of work. And you need to make clear management and communication of vision and objectives. So the implementation of digital transformation projects will fail without a senior clinician either sponsoring or leading the change. They need to set and share the vision with others within the organisation, and that's both those below them in terms of clinical superiority, but also those managing the business. We struggled initially to get enough engagement, and then hit the tipping point about 3 years ago where we almost ended up with too much engagement. And this has led to a lot of work and a backlog of requests. Because of this, we've then retrospectively reviewed and reshaped our government processes to ensure that we can sufficiently prioritise requests in the future and ensure that the new developments will be appropriately linked to the businesses or the organisation's objectives. So what else? In 2012, the NHS organisations that are directly linked to the UK government had no thoughts of personal health records. So back when we started, there was no national agenda with personal health records. Today, things are improving, and COVID has definitely helped to move attitudes forward on the need for digital patient services that can support remote care. However, plenty of the information standards issues that we originally needed help with, for example, relating to information governance, still persist. Organisations now understand the difference between a clinical record and a record that a patient owns, but information governance standards haven't yet been adapted appropriately, and this can slow us down at times. So whilst we've done a lot of work kind of within our own trust on this, we often find that it's quite a new concept with the other hospitals we work with when we work with them to roll out a My Medical Record site for their trusts. I mean, the good news is that despite a lack of help, we've got to where we are by getting on with it and working with Get Real and also our clinical teams to create exciting new solutions. And today we're nationally considered an exemplar, but we still need help from the government end of the NHS in support with things like standards. We try to engage our patients in many ways. To enable patients to register on the platform, we've developed a tool that enables the hospital teams to manually register patients whilst in clinic. And we also have an automated invite-based registration process that allows all patients referred to our hospital to self-register with a unique code and link. And we'll also soon be implementing the NHS login, which is a national identity service. And that will significantly help our scaling efforts with low to zero admin overhead. And we've also tried to involve patients at every stage of My Medical Records development. We've run patient focus groups where patients have supported us with testing and giving us their feedback on new features. We hold an annual patient conference, which includes interactive workshops. We also held drop-in days where patients can pop in for a cup of tea and a biscuit and ask us anything about the platform, so support issues or just because they want to find out more about what we're doing. We do know, however, that we need to do a lot more of this, and our new upgrade, which will be going live very soon, will effectively be a relaunch of our platform with increased comms to our patients and an increased presence on the hospital site to support signing up of patients and any support needs. So what's next? We're very close now to completing the work on the major upgrade with a new framework, and this should be going live in the next week or so. We've got our aim of 500,000 patients to be registered on the platform, which is not an insignificant challenge, but one that will provide increased benefits to both patients and clinical teams. We're looking to create more digital pathways within the hospital as well to support the hospital's outpatient reduction program. And then we also have kind of the scaling of the platform both across our region, so within Hampshire and the Isle of Wight, and also nationally. We have another 10 hospitals from around the country that will be coming on live within the coming months. And then finally we also have the NHS login work, which will be a massive benefit for the patients because it will allow patients to have one NHS identity or login that they can use for multiple services. So they'll be able to log into My Medical Record with the same username and password that they also use to access their GP services or other local community NHS services. Yeah, that's it for me. Thank you.
Thank you, Matt. Now we are going to our final transition to Ali in the Middle East with our partners from MEDRAH.
Hello, hi everyone, and beginning to introduce myself. My name is Ali Jum'a, and I work as the Chief Business Officer for MEDRAH Information Technology. MEDRAH Information Technology, we are a healthcare consultancy company based in Dubai with offices across the Middle East region. We have offices in Abu Dhabi, in Riyadh, in Amman, and we carry our operations across the region. Basically, in MEDRAH, we provide healthcare consultancy services along with value-added software like Get Real Health and others. We work with most of the international companies to integrate and to implement their technologies within the region. We've been involved in several national projects in the region, like implementing e-prescription across the Saudi Arabia, like implementing a health post office for all the financials across Saudi Arabia, and many other projects. I guess like the why we work with the Get Real Health and where we see the opportunity. The Middle East is transforming very quickly these days, and I guess like the major transformation which is happening in our region, that most of the governments that are moving their healthcare systems or the model of care from being a fee for a service to be more as an ACO. And part of that, they're implementing several technologies like implementing the health information exchanges across the region. And part of that is the patient portals. We worked with the key stakeholders in most of these customers on evaluating who's the best patient portal, and our was like to partner with Get Real Health and to start working with them in the region by promoting their technology. And I guess there's like a big demand in the region on that. Hopefully very soon we'll be announcing our first national site with Get Real Health, which will be our first in the region, and we are expecting several more projects coming here. As I mentioned, that the healthcare in the region is transforming very rapidly in the region because of changing the model of care, and several transformation projects happening where we see that the patient engagement and we see the patient portal, it will be a very key element in all of this. So I guess that this is like in high level my quick presentation, and I'll turn the microphone back to Amanda and Robin.
Yes, thank you, Ali. And at this time, you will all be unmuted, and I will pass it over to our president and founding partner, Robin Wiener, for the roundtable discussion portion of the event.
Fantastic. Thank you, everybody, for presenting today. This was so informative. And we're excited to actually have this more opened up to having questions from the panel, everybody to ask the panel. We are hoping next year we'll be able to have this all together like we've had in the past few years. Because I have the interaction between one another. I think it'd be fantastic. Christina. So I think just remind everybody that you are been taken off mute. So if you need to go back on it, go ahead and do that. So we've already gotten one question sent in to us, and excited about that. And want to thank Alan. He's up in Canada. Somebody we worked with for lots of years. And his question to the panel is, can you speak about patient registration? Has it been a challenge, or are any lessons learned over the years about streaming the process? Why don't we go ahead and start with Matt on that, because that's something that you guys have been doing for multiple years. So talking about registering the patients, and how's that been for you, Matt?
Yeah, so as I mentioned in the presentation, we have two primary ways of registering patients at the moment. So we've got a registration app.
Okay, I have no concept of.
That the clinical teams used to manually register their patients. So that would be like face-to-face in outpatient appointments. And we've also recently, or within the last year or so, developed an automatic tool.
I'm on their website.
Automatic tool
I'm
for
on their website.
Hey, Kim, you're off mute. Just want to let you know.
Sorry.
No problem.
It's cool. So yeah, so we also have the automatic the tool we've developed. So as soon as our clinical systems receive a referral for a patient, we can automatically register patients. We do know from the clinical teams that they see the manual registration of patients as kind of quite a bit of a burden, or not a bit of a time burden when they're kind of already busy, like especially kind of with everything that's going on. So we will be over the next year looking at new and more efficient ways of registering patients. So one idea we have is around automatically being able to sign up patients for a record, or invite patients to sign up for a record once they've attended an outpatient appointment. So at that point, the patient will kind of know about the record, and then we can automatically sign them up if we have their details. So kind of all in all, patient registration can be a bit of a slog. We've had some teams that are much better than others. And what we're trying to kind of find is it's all about trying to find a new and innovative ways of doing this. So trying to do it, automate it as much as possible, and also getting feedback from the team. So the teams that are on the ground actually doing that registration process, getting feedback from them. And sorry, very quickly, the other way that we're going to sort of attack registration is going to be with NHS login. So that will allow us to actually get patients to kind of self-register for the site. And it will be a completely kind of admin-free process because the NHS login will have already done the authentication of the patient against their NHS record. So then we have that token from the NHS login, which will be a major step forward for us, because that's the kind of the first true self-sign-up patients, the first ability for patients to self-sign.
Fantastic. Jan, do you have any thoughts on how we're going to be rolling it out in the Netherlands, and kind of the push of how the government's going to be part of that that push to get people registered into the PGO/patient engagement platform?
Yeah. So we have a bit of a challenge there in the Netherlands. And that means that if you are, for instance, you log in Amazon or your local bank, etc., so that is almost very smooth in doing that. But because it's healthcare, what the government said is that you have to have two-factor authentication in a certain way. And that means that, so we have our, we call it DigiD, that's the Dutch way, for instance, to log in your tax forms, etc. So that is a national program. And we are forced as a PGO, every PGO in the Netherlands, so every platform has to use that. And that can be a boundary for patients to log in, especially if you're elder, then you have to have that code by the government, etc. So what we're trying to do now is that there are different and easier solutions to log in. And that's also what we're working on at this moment. So we are restricted by law is to do it in a certain way. So we also have to do internet penetration tests because it has to be a safe environment for patients. So in one way, we have a government who's supporting this and also set up a website. You can click on it and every citizen can use it. And yeah, it is a trade-off between, I would say, security, our national guidelines, and user-friendly. And it is not solved at this moment in the Netherlands, but we're getting there. And that is a big debate also for hospitals. For instance, if you log into a patient portal, then also you have to have two-factor authentication, etc. So it is good when it comes to security. For user-friendliness, it is not always the best way to go into there. So that is, and so a lot of what we try to do in the pilots is to really engage patients together, to sit down with them and to say, okay, this is the way how to log in. Because also patients have to give their trust also to the caregivers. So the caregivers cannot use their data in their personal health record without the patients are agreeing on that. And that's also in our law and also in the way how we work.
Excellent. So before I ask another question, is there anybody in the audience that wants to ask a question or anything that's, I know we've asked, you can put them in the question mark, or since everybody is unmuted, you can unmute yourself and ask a question.
Hi, this is Abdul from Canada. I have a question in relation to how you track active users. So meaning, do you track active users for the purpose of understanding the level of engagement and the frequency of the usage of the tool? If so, what are your criteria?
Go ahead and, Matt, do you want to start off?
Yeah, sure. So we currently do kind of monthly reporting for our clinical teams or our overall steering group in our teams around how many patients are registered on each of our pathways, how many patients are active, and we say it's active, we're talking about like 3 logins in a set time period, and also then looking at how many patients aren't active. Different teams use this in different ways, so you tend to find some of our cancer pathways, obviously the patients are very engaged, they're using the platform regularly to get results, whereas some of our other platforms, pathways, maybe didn't know exactly what they were trying to achieve with the platform initially, and you can probably see that with some of the engagement figures from patients. So it kind of is, we do track those and we report on them regularly, and the data is used in different ways by different teams. We also use Google Analytics to get a better understanding of how patients and clinical teams are actually using the platform, kind of which pieces of functionality they're using, which pages they're using, are they staying on the site, and we can use then that kind of in each kind of iterative process of our platform to work out or help to plan what we're doing. But it's not just about kind of looking at the engagement in terms of the numbers of people visiting. It's out, like I also mentioned, about speaking to patients and the clinical teams about how they're using the platform, making sure that they're fully engaged in each stage of the platform's evolution.
Fantastic. Thank you so much, Matt. Now, Jan, I've got a question for you. From Wagner is saying, great presentation. He was wondering if you could share some of the results and how many users are already subscribed into the solution, and what we're seeing is the most used feature. I know we've got only a small pilot going on right now. And the other question was, he was wondering what your personal favorite feature was.
Okay. Now, just by starting by the last one. So my wife is, she has a chronic disease, and she got a lot of data from, and actually she doesn't own any data. We have a lot of portals in the Netherlands, hospital portals, GP portals, etc. And I sometimes call that the sickness portalitis. It doesn't kill you, but it's very, it's terrible for patients. So the most important feature, I would say, is that a patient's got the data on one place, from the GP, from hospital, and maybe mental care, etc., in one place. So that is a very big improvement, and that every citizen in the Netherlands can actually choose their own PGO with functionality. So that is one of my personal favorites. What we see in our country is that because of COVID, the use of portals, or hospital portals, is increasing very much, and it's rising. We've got hospitals with 70-80% of all the patients are using our portal, but a portal is not a PGO. And that's where we are. And the question is, how many patients have you involved? So in the first start, we have about 40 or 50 COPD patients who were using it. They were very pleased with it. And what we are now doing together with those patients is to scale up to a whole region. And what we are looking for is especially what could be the trigger to have something new. What is new in the Netherlands, that you actually can get your data. And is there a silver bullet that people are actually going to use it in such a way to scale it also up? So if it comes to the numbers are not great. The potential is great at this moment. And I sometimes compare it with the beginning of the internet. So that people are, if you don't know or what is an iPhone and you never used one, how do you going to use it? And that's where we are when it comes to the personal health environments, not for portals. I think that's something different. And what we probably will see is, so one of the ideas is of our national government is that, for instance, all the COVID vaccinations and the outcome of that will be transferred to a PTO. And if you maybe be going to travel in half a year or 1 year or something like that, and you have to show that whether you are have a vaccination or not. These kind of things that will, I think, improve the use and also the numbers. So to summarize it, people are not very acquainted at this moment what a PTO can do. What you see is that if someone sees it and what the potential of is, then people are very interested with it. So it's, yeah, again, it is new.
But it's coming.
It is coming.
That's right. Ollie, I thought maybe you could talk a little bit about how important it is to be able to do a person platform in multiple languages, and just the diversity of the region that you're in, and how important it is to be able to connect to those patients, not only in English, but also in Arabic and other languages. And also maybe talk a little bit about how tough it is to get into the region, and how it takes a long time for anything to be actually closed because there's such competition there.
Yeah, so I guess like the Middle East in general, or if I talk more about like Dubai where I live, it is more like a multinational city where there's 120 nationalities living there. The demographics of the country as the UAE, that the locals represent less than 15% of the population, and the rest are coming from everywhere from the world. And we have a very high number of visitors around the world. So this brings a challenge that one language is not enough for any patient portal. And there's like main languages like the English language, the Arabic language, and the Indian ones, like the Urdu or Hindi. So that's why, like, for us, it's always a challenge to have multilingual systems to be able to engage with the patient and to be able to engage with the different segments of the society. So working with Get Real Health, like one of the main factors, like why people around the region, they like Get Real Health is because they have developed all these languages within their system from day one. And we were surprised that even they have the Arabic language before telling to anyone in the region. So that was like as added value, and something which everyone in the region likes it. Like I said, this was the first question. I'm not sure if you want to ask the second or one more questions.
I would just say that because there's such competition right now in the Middle East, that it is a longer sales cycle. And to be able to break in there, especially being a U.S. company. And for us, it's been so important to have a partner, a strong partner like you guys there. But I mean, you see it across the region, business is done a little differently, and it takes a little bit longer than what we see in other countries. It's just a good insight for people to understand how it works out over there.
That's true. So I guess like the basic thing that in here that it is the transformation of model of care happening now, which makes everyone to have their own or own vision how they're going to implement that transformation. And part of that, there are several tenders has been floated, different consultants part of that. And I guess like one of the challenges that they said, many of the customers, they said, you know what, like patient engagement or patient portal is not that complex thing. We can develop it easily. And this is, I guess, was one of the major challenges which we had in the region, where all these customers they were thinking of developing it and contracted even some of the big four companies to do it. They realize that it is not that easy, and they need to have something which is more more flexible and as a platform. And this is where I guess like Get Real Health came into the picture, where it showed like it is like a platform where it is you have all this widgets which is developed and covering most of the requirements. However, you have the flexibility to develop your own and to add more function or to develop and integrate to the existing systems and the future ones which they have using the CH-based development platform. So I guess like that was like a game changer and was a big differentiator for health in the region.
Excellent. Yeah, and actually we're going to be announcing pretty soon because of exactly what he just explained. We just got a very large new client there that we can't talk about yet, but it's coming soon. I'm just going to ask, we only got a few minutes left. Is there any other questions from the floor? Anybody want to ask a question quickly? We have one more. What's your experience on clinicians' relations to patients portal? Are they worried about it or are they advocates? And honestly, I think probably this would be a great one for you, Matt, because you've been doing it for a while now.
Sorry, I missed the first bit there. I heard the advocates bit.
Yeah, clinicians, are they comfortable with patient portals, or are they advocates for it, or are they uncomfortable about having the patient portals and that feedback from the patients?
Yeah, so it's really interesting. So all the clinicians who using the platform, I would say we're advocates. So I mean, we have a number of very prominent clinicians within the trust. We've got kind of fairly big national profiles who are backers of ours, and they can see the real benefit. I mean, if you speak to the cancer teams in particular, the ability for them to manage the volume of patients they can do is phenomenal. I think, like what I said in my presentation, they used to see 6 patients an hour, they now can see 30. Think about Cornwall, where they use the prostate cancer platform. I mean, they have thousands and thousands of patients, and they would just never be able to see the patients in face-to-face environment again, due to the number they have. But it is quite interesting. So when we're kind of out and about speaking to new hospitals, you often get clinicians who are maybe uneasy about patients receiving lab results, and often without a delay. So we used to delay a lot of our lab results going to patients so the clinical teams could review them first. Many of the clinical teams we've worked with have now asked for that delay to be removed because they want their patients to be empowered to get the results often before the clinical team see them. When the patients are then educated about what they need to do if they see a rise or drop in any result, and it's really empowering for the patient. And again, talked back to the co-production and putting the patient at the centre of their care and really empowering them to manage or co-manage their own healthcare. But yeah, so lab results is people, maybe the clinical teams that don't understand what pH are and fully understand the benefits are often a bit wary of things like lab results or maybe even the messaging, because they can see it as potentially just something else that's kind of going to be added to their already hectic days that they need to manage. But like I say, messaging makes things easier for clinical teams. Messages go up, phone calls go down. It's much easier to be able to block out half an hour in a day to respond to messages than potentially be trying to clear all of the admin that goes around a patient's care and have the telephone going off kind of every 2 minutes as well. So the clinicians that get on the platform love it. Initially, you might find clinicians are wary or apprehensive, but once they've spoken to their peers or been able to see demos from other clinical teams using it, I mean, often they're kind of, yeah, they're all over it and want to be able to implement the platform for their pathways as well.
Fantastic. Okay, Amanda.
Yeah, so we are at the top of the hour, so I think we'll go ahead and wrap things up. I would like to thank everyone for joining us, and a special thank you to our speakers. I also want to remind you that we will be holding another roundtable event with our clients in the United States. You will receive a follow-up email with a link to register for that webinar by tomorrow. Thank you all for joining us and have a great day.
Thank you, guys. Bye-bye now.